what you spend. That's how our system works today, and that clearly has to stop. We need to know and have a connection to what the cost of services are. We certainly need to be incented to be healthier to begin with. And we have to get off the hamster wheel of fee for service, which is how we pay our doctors and hospitals. If you think about it, the doctor that gives me the most value is probably the one that helps me not see them very often. But we don't pay a doctor for that in our current system. In fact, our primary care physicians, they get the shortest stick when it comes to our healthcare system. We completely overpay them, and they literally are the most important component of our system. So we have to know what stuff costs. I disagree with the statement that markets can't work in healthcare. Of course they can. We haven't tested it yet. When's the last time you knew what your services cost and knew what the differences were from one physician to the next? But the things I'm talking about aren't fixed overnight. And there's something that literally takes a change in mindset for all of us individually. I don't think this is going to be a situation where someone comes down and hands us a simple solution. I think if it was that easy, it would have happened a long, long time ago. I think it's going to involve every one of us being part of that solution.
So I think your question is the one that everybody's struggling with. And regrettably, there's not a quick solution. Right? I mean, the quickest solution for you, quite frankly, would be if your mom could put you on her health insurance plan, right?
Yeah.
I mean, that's what the Affordable Care Act allowed for. But I would, and I also want to make the distinction between knowing how much things cost and having a market are two very different things. We'll debate that another day. But what we do agree on is that our fee-for-service model is completely out of whack. There's no question about that, and we just have to get over it. The two things I would say as a state where we could be directing more attention and it could lead to measurable benefits for you is, one is just getting a handle on those high-cost patients and really supporting upfront the efforts to manage the cost of their care more productively and effectively. We know where those people are. We know how to do things to improve their outcomes. And in fact, there's a rural hospital in this state that hired a social worker and a nurse to work with some high-cost patients on transitioning them from their providers and being sort of a navigator through the health system. In 4 months, they saw a reduction in costs associated with that patient cohort of $3 million. Now, what does that mean for that provider? It actually means they're going to have to lay off some nurses if they're really effective, right? Or even some docs. And so that's one of the sticky widgets in this is everybody's got to come to the table and sacrifice. The other thing I would say is that we have to prioritize prevention and wellness. Now, the fundamental issue we face in our healthcare system, and it's whether it's the lack of transparency, whether it's the structure of the system, is the incentives are not aligned between insurance companies, healthcare providers, and patients. And until we figure out how to better align those incentives, quite frankly, this is an unpopular statement, but I think of insurance companies as toll collectors. And they take their toll as I come through. They obstruct my view from where I want to be at the end of the day, and they slow down the process in some ways. So I think there are some sticky questions, but there are a couple of solutions that are in the near term.
And we have time to close our last.
I think you both agree about what the problems are. I think the problem with this law is it did nothing to address any of them. All it did was to contract the whole entire insurance. The insurance is that the expensive people are covered by the mass. Every insurance population has the 90% and 10% split. And all we did here was to create a situation where the less expensive people could opt out of participating in paying for the others. And that is contrary to the whole idea of insurance. And it may have benefited a few people, but ultimately it doesn't help the system in any way.
Well, the Affordable Care Act tries to, if you picture it on a scale, they're trying to cover more people. This is the federal law. And then, of course, you got to pay for it. And they went to guarantee issue community rating basically nationwide. And the lawmakers recognize that, okay, we can't just tell every insurance company, you got to take everyone, you can't ask them health questions, you can't exclude pre-existing conditions if they don't have to buy insurance, because, well, I'll just wait till I get sick and then I'll go buy insurance and then I'll cancel it. That literally happens in Maine's market today. I can give you tons of stories of that, where someone comes in, buys a policy, gets their service, and then they dump it. So they needed to strike the balance and have the mandate, which says everyone's got to be in the pool, we all got to purchase. But remember, today we don't have that. We have 1/2 of that scale in the state of Maine, which basically means the insurance company has to take everyone. There are limits to what they can do in terms of pre-existing conditions, but you and I don't have to buy. You know, you're a great example. You're not today. And probably for obvious reasons. Your likelihood of needing the policy and needing care are slim right now at your current age and health status. So somehow that market has to attract the right balance in. That means it has to strike a chord for somebody and be a good economic decision. And so I agree that this law doesn't solve the broader problems, but I disagree that it isn't a huge step in the right direction to stabilize our insurance markets. Remember, we've been in this death spiral for a while. Eventually, it does hit the ground. I mean, we can keep our insurance laws exactly the way they were currently structured, and we're down to basically one carrier in the individual market. We got 3 holding on in the small group. Let's get down to 1 in the small group too and see how things go for us.
So I just want to respond. Whether it's a death spiral in Maine's market or a death spiral nationally, it's a death spiral everywhere. And there's death panels, death spirals. We can use all the death terms we want. But I think